Every year, there are around 250,000 bariatric surgeries conducted in America, and on a global level, around 580,000. And who knew? I certainly didn't before I had bariatric surgery and joined the bariatric community. That's partly why I decided to start this channel. I want to do my part to get more information out there, because had I known maybe sooner how successful I could be with this surgery, I might have done it a couple of years before. I'm Sonia in Cyber, and I had bariatric surgery, Roux-en-Y gastric bypass on 9/6/23. As of this recording, I'm down over 100 pounds, around 7 clothing sizes, and I'm happier than ever with zero regrets for having this surgery. It was absolutely not easy, and I wanted to create this space, Bariatric Baddie, to help empower you to thrive before and after weight loss surgery, whether you're someone that's already on the journey, thinking about it, or that's already done it and just looking for more community. I'm happy you're here. In this video, I want to briefly touch on different qualifications that you may need to meet to be able to have bariatric surgery. So it's really meant for anyone thinking about it or already on the journey to just educate yourself a little more on what you may need to do or what requirements you may need to meet in order to have your surgery. Now, I'm going to turn this particular topic into a series because I want to make sure that I leave enough room to go into a little more detail on each one of these topics individually. And you can find those particular videos as part of this series on my channel as they become available. Now, if you're not already subscribed, make sure you hit that subscribe and the bell so that you are notified as those videos come out. Now, before I dive in, I just want to put this disclaimer out there, as I do with all of my videos, that I am not a medical professional, and even if I was, I am not your medical professional. Make sure you are always deferring to your medical team when it comes to medical questions specific to your health. These videos here are intended to be peer support, community support, and help you get a firsthand account from someone that's actually had surgery and that's been very successful with it, but absolutely not a replacement for medical advice and guidance. So let's dive right in. Now, the qualifications for bariatric surgery are going to vary from person to person and mostly depend on one, who's paying, whether it's you or the insurance, two, what your personal situation and goals are, like how much weight are you trying to lose, what's your current weight, what are the comorbidities or different health conditions that you're dealing with, and three, what surgery you're actually going to pursue or try to have. There are several kinds of bariatric surgery, and each surgery has their own specific qualifications, but there are certain things that carry across all of them, like having a BMI requirement. Now, a word on insurance versus self-pay. There will be requirements or qualifications for either option, but what those are, again, will vary. With insurance, you typically have a longer amount of time, like a qualification period that you have to meet before you're even allowed and approved to move forward for the surgery. While with self-pay, you may be able to get in a lot sooner, but your surgeon's office may also have some additional requirements and qualifications that they're asking for. Of course, you can work with either your insurance or the surgeon's office that you're looking at working with to get the specifics on their requirements. So let's dive into qualifications. First and foremost, you have to be 18 years or older. There are some exceptions to that rule, and occasionally insurance may pay or surgeons' offices may be comfortable having bariatric surgery done on someone under 18, but in general, you need to be at least 18 or older. And honestly, after having gone through the surgeries myself, I totally see why someone under 18 may not be the best fit for this surgery. It is a massive life change. It can be extremely difficult. And I do feel like having a couple of years of life experience and being more of an adult would help you be a little more successful. You have to be above a certain BMI for any of the bariatric surgeries that you might pursue. Now, what that actual number is, that cutoff is going to vary from surgery to surgery. Your BMI has to be considered obese, and not just obese, in most cases severely or morbidly obese. That translates for most people having somewhere between a 35 plus or 35 or higher when it comes to a BMI, especially if you're looking at a sleeve or a gastric bypass. With a gastric bypass, there may be an extra requirement, especially if you fall between 35 and 40, for you to have also a secondary health condition that is related to your obesity, or they call it comorbidities. There are cases where exceptions will be made, and they may consider you with a lesser BMI when there's certain comorbidities in place, but that's one of those things that you have to work through with your insurance or your doctor's office wherever you're having surgery. In my case, when I had surgery, I was right at a 40. So I wasn't quite above 40, which was kind of what I needed without comorbidities, but I had multiple comorbidities that then made me qualified. The comorbidities I had that made me qualified for my Roux-en-Y gastric bypass at a BMI of 40 were asthma, sleep apnea, high blood pressure, high cholesterol. I had hypothyroidism, PCOS. I feel like I might be forgetting one, but you get the idea. I had multiple conditions that could all be linked to my obesity or being more severe, like me having problems with all of those things thanks to my obesity. So that made me qualified. I also know several people in the bariatric community that had BMIs lower than that, even lower than 35, that because of additional comorbidities, they were able to qualify. I will also say I was a self-pay patient, and despite that, I still had to meet those requirements for my surgeon's office. I've seen people get approved for bariatric surgery with BMIs as low as 30 because of comorbidities that they were dealing with too. So it really just depends on your situation, your BMI, and whatever health conditions you have going on. In addition to the BMI and the comorbidities requirement, you also need to be able to show that you've tried to lose weight on your own over longer periods of time in the past. In my case, I was able to bring up that I had tried diet and nutrition multiple times over for several years, and of course, it didn't work for me in the long run. I also was able to show that I had tried like Weight Watchers, Jenny Craig, I had tried physician-approved programs, and then I also had tried GLP-1 medications. I was on Wegovy not once, but twice. And the first time, though I lost around 60 pounds, I wasn't able to keep it off as soon as I was off the medication, which wasn't ideal. And the second time, it didn't really work at all because I was using it at the same time as a new medication I was taking for my thyroid issues, and those didn't really work well together. It actually ultimately made me gain weight. So it wasn't a good answer for me. Now, in addition to those requirements, if you're using insurance especially, you may have to enroll in an actual weight loss program before you qualify to have bariatric surgery, especially if you don't have a long history of you actually trying it or anything that's documented that they can see. So they may put you in a program and give you a certain goal to meet. You may have to lose a certain number of pounds before you're allowed to move forward with surgery. But just think of that as a kickstart to get you on your path to a much healthier version of you. Now, another qualification or requirement that a lot of people don't realize, and is probably one of the most important, my friends in the bariatric community absolutely agree, it's the psychological evaluation. A lot of people don't realize how important, how critically important being in a good place psychologically is for you to be successful with bariatric surgery. Many of us, me included, would argue that the bariatric surgery journey is 90% mental. Another super important qualification that you absolutely need to be truthful about and meet before having bariatric surgery is any kind of substance abuse, be it alcohol or smoking especially. Both of those can put you at huge risk with bariatric surgery. So you absolutely should be honest about that. If you're smoking, you may end up needing to go into some kind of smoking cessation program so that you can stop before you have surgery. I've known several bariatric patients that ultimately had to delay their bariatric surgery because of smoking. Now, do not try to be that one person that lies or tries to go into it without being truthful in relation to your smoking habits, because it can absolutely put your life at risk. Same thing goes for alcohol. There is a big tie between alcoholism and bariatric surgery, and even many cases where people end up no longer here because of alcohol and bariatric surgery. I will talk about these, just like with everything else here, a lot more in detail on a separate video, but I just cannot stress enough that these qualifications absolutely need to be met on your end, and you need to be honest about it. Now, another piece of this that will come into play that has to do with qualifications is pre-testing. And that may or may not come as part of that like pre-qualification process, or maybe once you're absolutely already in that process of getting to your surgery. But I want to make sure that I mention them in this video. The kind of tests that you may end up getting are things like a sleep study to check you for sleep apnea. You may end up having to do a bunch of blood work. I mean, that's standard. You're going to really need to get used to blood work if you have any of these surgeries. They help to ensure you're staying healthy and you don't have any issues with even things like malnutrition later. You may have some kind of ultrasound of your abdomen or some other kind of imaging. You may end up having to get a cardiac clearance. I had to do that. So you'll get probably an ECG, EKG, something like that in relation to your heart to make sure that you can make it through surgery safely. and basically all the bodily changes that are coming. Obviously, they're likely going to check how your lungs are functioning with asthma and things like that, your liver, and then they likely may also check your upper gastrointestinal tract, because GERD is something that a lot of people can deal with bariatric surgery, so you likely may end up having to get that checked too. So that wraps up the qualifications for bariatric surgery. If I'm missing anything, I'll make sure to do another video following up on this, but I hope that this one is a good starting point for you on things to think about that you'll need to meet if you are trying to have bariatric surgery. Now, if you want to get started on watching the rest of this series where I go a little more detail into every one of these topics, you can find the first one right here. No matter where you're at on your journey, I'm so glad you're here, and I hope to make content that is valuable to you. So if there are certain questions or topics that you would love to see me cover in a future video, let me know that below. And I'm curious, what part of the journey are you on right now? If you've already had surgery, what pre-qualifications did you have to meet? Was it all of these? Were there other ones that I'm forgetting? And which ones did you feel were most important or maybe surprising to you? And if you're just starting your bariatric journey, what things do you have ahead of you? Are there any parts that you're nervous about or that you're even surprised about that you'll be having to do? Either way, I hope this video was helpful for you. By the way, I'm putting together a bariatric community to help support Baries at all levels of this journey, so stay tuned for information on that in my description or about section once available.